People think the hips are just on their sides, but the hips really do extend all the way back. You okay?
I didn't know that.
Yeah. Yeah. Hips are a big area. So now that I've kind of loosened up some of this area with a smaller cannula, I'm going to use a little larger one. And as you can see, to the naked eye, it doesn't look any larger at all. See, it's barely any bigger. And the patients usually don't notice any difference at all. Very important to use your left hand as a sensory hand. You can always kind of feel where the tip of the cannula is.
And you said the swelling goes down in about a week?
Month.
About a month. But the second day, let's see what it looks like.
After about 48 hours, when the lidocaines drain out and the inflammatory reaction hasn't started, I tell patients to kind of take a snapshot of themselves because that's what their final result's going to be similar to.
Okay.
And the patients all tell me how happy they are at 48 hours and then it starts to inflame and they're like, whoa, 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 what happened? I was looking so good. I'm already feeling there's just not much fat left right there. That's mostly skin, but I still feel some here. Very important in liposuction to not over liposuction. If you rasp away at the skin and get every layer, you're going to end up with skin attaching to the muscle. It's so important to constantly be feeling what you're doing and not just keep doing this blindly until everything, you know. It's also important not to look at that and think, oh, okay, I have to keep doing it until I get so-and-so. That's not the way to do liposuction. You need to feel and just keep your eyes on the patient. Rather than think, oh, if I get a liter of fat, then I did a good job. No. In liposuction, my cardinal rule is you can always take off more, but you cannot put it back.
Right.
You cannot put it back. And that's why I do free touch-ups. I'd rather come back and take off more than have somebody who has a big dent because they were over liposuction. You can't do anything about that. Well, I've been an anesthesiologist in North Carolina for about 12 years now. I'm prepared for that question. I've always done some aesthetics on the side. I've always just enjoyed it. You know, I love anesthesia, and I'm still a practicing anesthesiologist. I still work about 4 to 5 days a month because I love anesthesia. I love critical care medicine. I love the excitement of it. But it's a very stressful job, and I started doing aesthetics on the side just to kind of have something that was a little more fun, a little less stressful. Not to ever replace anesthesia, but just to do along with it. Different patient population. It's a much simpler kind of medicine in that you don't have to deal a lot with insurance companies, and it's a very satisfying job because you just end up with all these happy women coming back.